Hey friends, welcome to 1 Minute with Monet. Balance doesn't happen overnight, but it does happen one intentional minute at a time. This podcast gives you the tools to make it happen. I'm your host, Monet, your favorite concierge and founder of Time Managed LLC. Join me each week for practical tips and real examples to help you manage your lifestyle with ease. Hello and welcome to another edition of 1 Minute with Monet. I have the privilege of speaking with Dr. Koon from Rainbow City, Alabama, about the benefits of chiropractic care and how we can use that care in our everyday lives. Welcome, Dr. Koon, and thank you for being here. How are you today?
I'm great, and thank you for having me, Monet. Thank you so much.
Oh, you're most welcome. So let's just start with the basics. Tell us about yourself. Why did you choose chiropractic care as your profession and not another form of medicine?
So, chiropractic was kind of a thing that I discovered when I was a teenager, and I don't have really an amazing story about how I got introduced to it. Um, so no direct causation, but I did see a lot of crazy things when I was growing up. My mom, she was diagnosed with breast cancer in 2006, and in 2012. And thank God she's still here today. But I did see her go through the medical side of things, the oncology side of things, and I believe that was a pretty large influence as well. Just kind of getting towards the more not necessarily alternative, but more natural side of healthcare. So I kind of started doing my own research. I started to see some good case studies on things like YouTube, which we'll probably talk about in a little bit, and it just really inspired me to kind of go down that journey.
Okay, nice. And then specifically, how do chiropractors care for their patients? I think sometimes we think of just, someone, I'm going to go and get my back adjusted
Mhm.
or my neck cracked because I'm a little stiff. How do chiropractors care for their patients?
On the top, obviously, we're treating pain, and we're treating joint mobility. So we're helping people live their lives pain free, but we treat them directly through the adjustment. So, and the philosophy behind chiropractic that we use is actually on the wall behind me. It's the power that made the body heals the body. And some people overcomplicate it, but it's really just a basic understanding of our body and how it works. For example, if we go look at a cadaver or model spine right now, I can show you how I adjust a vertebrae based on what the issues are in your body. And we would actually see how bone inflammation would actually come off of nerve that creates pain. So we treat patients through the adjustment, and really at the core, that's what chiropractic should be: is spinal adjustments, removing nerve interference from the body, and removing pain and restoring function as well.
Got it. Got it. Now, there are plenty of myths out there about chiropractors. What are some of the ones that you hear more often?
Yes, ma'am. So this one kind of irks me a little bit, and I always have to be like a little nice about it. But it's if you see chiropractor once, you have to come forever. Okay. And my question to follow up would be, if you do something that benefits your health and makes you a healthier person, would you stop doing it or would you continue to do it?
Hmm.
And obviously I say that in a much nicer manner, but it just depends on what you want. If you want a quick fix, chiropractic can be that. If you
Hmm.
want a lifestyle that restores function and healing to every cell in your body, restores joint mobility and promotes longevity in your life, it's something that I would recommend doing for a lifetime. For ourselves, for our patients. I mean, we try to get adjusted once a week. I tell my patients, I don't expect you to be here every day of your life, every week of your life. That's just not realistic sometimes. But if I told you to come back and see me every 3 months when you're in a bunch of pain, I'd be selling you short on your wellness and then feeling good all the time.
Right. Now, another myth that I've heard is that chiropractors are trying to take the place of your primary MD. Is that true?
No, not at all. Um, and we don't, most of us at least, don't want to prescribe medications. We want to keep you away from them. We don't have the scope or ability to prescribe medications regardless, and we don't want it.
Hmm.
There has been some states in the country that have kind of gotten that philosophy mixed up a little bit and say that they want some of that,
Hmm.
but no, absolutely not. And on the flip side of that, a lot of people think that it's chiropractor versus PCP, and we work with PCPs all the time. If there's something that you need outside of our scope of practice, obviously we're going to try to help you as best as we can, but we're going to get you where you need to be.
Right. So at the end of the day, everybody wants you to you're all concerned about wellness. So whether you are managing pain from a chiropractor or your PCP is recommending an additional course of treatment, you can work together to get to that goal, which is for your patients to be well and
Right.
be pain-free and to live a healthy life.
Absolutely. And obviously, we're going to do everything in our power to, keep you away from, any medications, any surgeries. Obviously, there are small exceptions to that case, but really at the end of the day, there shouldn't be any bad blood. There shouldn't be any, us versus them versus us. We really just have to focus on what's best for the patient and what's
Mhm.
best for their overall health. So as long as each doctor has that in mind, we should be in good shape.
Right. And there are some tactics that you use that are more natural that you use in addition to your chiropractor training. Can you talk a little bit about that and how it supplements what you do as a chiropractor?
Yes, ma'am. This is an exciting one for to talk about. I love chiropractic. Don't get me wrong. We talk about it every day, but there's so many different things that we can do to be healthy. There's probably a million right answers. There's probably a million wrong answers. The biggest one that I would say, and I've kind of learned this personally, is number one, you have to make a choice to be healthy. We can decide to be sick, decide to go down that road of taking a bunch of different prescriptions, or we can actually do what's best for our bodies and actually let it heal itself like it's supposed to. There's different sides to the coin. Obviously, number one is your physical health. There's many things that you can do to maintain that. So there's exercise, stretching, nutrition. We got to have the right amount of sleep and rest. Obviously, chiropractic is a big one. That's kind of the one that's most obvious to people. And then we
Mhm.
get into the mental and spiritual side of the coin for our health. So for mental health, obviously exercise is an overlap of that. Stretching is an overlap. But we have, relationships, nutrition as well. We have rest again. So we start to see those overlaps, which, they're good for our bodies, good for our brains. Third one is a spiritual one. Some people want to deny it. It's there though, for sure. And one thing that we are called to do is to fast and pray. So fasting is a part of, my lifestyle as well that I've tried to implement, whether it's intermittent or, doing maybe a 24-hour fast. And it just has so many benefits. And
Mhm.
all these issues that we see today that people are being medicated for or people are spending thousands of dollars on could be fixed with fasting. And it's pretty amazing. And some, chronic illnesses as well. So yeah, I'll leave it at that for now.
Okay, no problem. So specifically, so you mentioned lots of different aspects, and I actually like to say I want to be happy,
Yes, ma'am.
healthy, and whole. And I think some of the aspects that you mentioned have to do with that. So when you talk about emotional wellness and mental wellness, that is also a part of making sure our physical bodies are maintained. And actually growing up, my mom, used lots of herbs and we didn't have when you look in our cabinets and even now in my own home, you look in our cabinets, I have more herbs and natural remedies than I do the pain relievers that you can buy over the counter, because I really believe that the natural way to be happy, healthy, and whole is
Absolutely.
to take things that are natural and not manufactured. But that does not mean I don't take any medicine or I
Right.
would never take a prescription from a doctor. But it's really about making sure that my body has what it needs to survive and that we're not relying on medicine all the time to be healthy and to be pain free. Aside from herbs, are there other regimens? And this is the time of year when we're thinking about that. Actually, we're thinking about how can I go into this in the new year in 2026? How can I make sure that I'm going to be healthy? Am I going to exercise more? Should I eat better? Am I gonna start changing my diet and regimen? Am I gonna start fasting? I have heard about intermittent fasting. I've never tried it because I like to eat. When I wake up, I just want to eat. I don't
Yeah,
want to wait till 12 o'clock.
trust me, I feel you. I try my hardest to practice what I preach.
Right, right, right. So tell us about a regimen that we can maybe a
Yeah.
sample regimen that we can take when we're thinking about creating a baseline for 2026 to start the year off healthy.
First, I think what you said is great. Obviously, as a chiropractor, I can't compete with the acute side of things. I mean, hey, if we have to take a Tylenol or some type of, antibiotic, we have to do it sometimes. We talk about wellness and preventing that kind of stuff.
Hmm.
Our bodies aren't deficient, in prescription drugs, but they can be deficient in, nutrients and vitamins and things like that.
Yeah.
So, as far as the regimen stuff goes, first of all, I've got to say chiropractic. So if you've never been to a chiropractor, even if you're without pain, just go get evaluated, see what your spine looks like, see what your posture looks like, see if you
Hmm.
can function better, right? I mean, just everything in our body comes from our nervous system. Right. So we've got our different segments in our spine. Each nerve root goes out to a specific organ. For example, someone with diabetic issues, with pancreatic issues, you might have a thoracic issue. Gut, GI, you might have a lumbar issues. Getting checked for that kind of stuff, would be a great idea. I mean, especially if you want to live a long time, if you want longevity. Second thing that I would definitely recommend is the intermittent fasting. That looks very different for different people. Sometimes we start with 12 hours, 14. But all it means is that we aim for a certain amount of time that we don't consume any calories or any chemicals, for that allotted amount of time.
Hmm.
I would challenge, anyone to start with that. Maybe a 12-hour fast, maybe a 14-hour fast, maybe skip breakfast one day.
Right.
You have to be careful. Some people, their bodies are just so used to consumption, and I'm not saying that in a mean way. It's just how we live. So we have to be careful with it, and we have to work our way up to certain things. So I would definitely implement that as well. Being that it's winter time, everybody loves to get sick. We don't love it, obviously. Our bodies
It
love to
just
get sick.
happens, right?
It
Our
happens.
bodies. Yep.
I definitely would recommend just your basic multi-mineral supplement, to help thyroid, to help every excuse me, what's the word? Organ in your body. Okay, that was a hard
Hmm.
word to find. Vitamin C, your B vitamins, definitely vitamin D3. We're all lacking that sunshine, and it's just killing our immunity during the winter time, and with this silly daylight saving stuff that we have going on. So
Yeah.
to keep going, honestly, exercise, and this is something that I'm trying to push myself to do as well. I mean, nobody's perfect on this. And I think that's the first step of realizing that you can do better. You
Hmm.
may not be that hunk in the corner in the gym. Let's just be honest. But if you can work out on a consistent basis, your body's just going to be so much better on the mental and physical side as well. So, number one, get your spine checked, make that a priority.
Okay.
Number two, I definitely would recommend, fasting, not just physically, but spiritually as well. You become closer to God. Number three, supplements. So like you said, herbs are great as well. God gave us the tools that we need to heal our bodies. And four is just movement. We've got to move our bodies to be happy and healthy.
I love that, and I'm gonna practice all of those myself.
Yes, ma'am.
I mean, I do a little bit, but I always feel like I can do better. And when I start slacking off, I notice how my body feels differently. So when I slack off on my eating, or if I'm not taking my supplements and vitamins, I feel that difference in my body. But the other good thing about that is when we're mindful about the changes in our body, then we know what we need to do to fix it.
Absolutely.
I know when I'm feeling down or if it's been cloudy and that's affecting my mood, okay, maybe I should take more vitamin D this week. Or if I'm starting to feel sluggish, maybe it's what I'm eating, and am I making sure my meals are balanced and I'm getting the nutrients that I need for my body. And I've been to a chiropractor maybe once or twice in my entire life, but if I'm generally healthy and I go and take that initial assessment with my chiropractor, what does that look like? Because if I'm on social media, for instance, and this is true, like I've actually seen someone say that they had a stroke because of a bad adjustment from a chiropractor
Right.
and ended up in the hospital. I've heard about tools that different chiropractors use that might look painful or cause pain. So when I'm going and I don't have a specific ailment, how can I get over some of the negative things that I might see on social media about chiropractors, and just ease my fears to then go in and say, how can you help me live a healthier life? Or do you see anything? What are those things that help me get past that and have a good conversation with that care provider?
No, I really appreciate this question because, I mean, just about 50% of the new patients that I see, they do bring up, I don't know, 50% maybe, but I see a lot of concerns, like you said.
Hmm.
And so I'm gonna do my best to answer this question in full. So if I get off track, please let me know.
Don't worry.
But the the first thing, I'll just tell you what we do in our office, and I feel very strongly about what we do. I feel like it's safe, very effective. But first, we got to do a full history. So we have to figure out, do you have any red flags? in your health history? Have you had any cardiovascular issues? What type of pain do you have? Do you have any neurological deficits? Things like that. Okay, and
Mhm.
make sure that we don't leave anything out. So number one, if your provider is not doing that, that's number one red flag. Number two, we got to do a thorough physical exam. So things like orthopedic testing, neurological testing. That can identify the deficits that you may have as well. It may look a little different in every office that you go to, but we can do the same thing multiple different ways. Third one, and this is a big one for chiropractic. I believe that all my patients should be x-rayed. There's a lot of chiropractors that aren't doing it. Now, don't get me wrong, there's exceptions like, pregnant women and children, but we just don't want to take any more risk than we should.
Mhm.
But here's the idea. If I don't see exactly what your spine looks like, how am I going to treat it the most effectively? How can I be specific with my adjustments in your healthcare? We say in this office all the time, I don't want to go in taking guesses about what's best for you.
Yeah.
On the other side of that coin, I see a lot of things on x-ray that we didn't know was there. I mean, Dr. McClellan, my boss and mentor, he's been practicing 40 years, and I know that he's seen tumors and cancers and things like that on x-rays.
Mm.
It's very rare, but if we have the ability to see that in somebody when they don't know about it and maybe catch something early, that's a big
Yeah.
part of it as well. Which is full history, exam, x-ray, treatment. That's all going to determine what type of treatment that we do. And that's where a lot of the concerns come in of what people see on TikTok and YouTube. Back when I got into chiropractic, there was some really, really good quality stuff, case studies that would explain everything that they're doing in the chiropractic office, show
Mhm.
people go from barely walking and antalgic to walking out of the office and feeling a lot better. Now it's just like we put microphones on people, and I hate to say it, but put them in the least amount of clothes as possible and start to adjust them and make a cinema out of it. A lot of people talk about the pulling on the neck technique. That's not a chiropractic technique that's taught in school. I haven't lost faith in my profession at all. I just know that every profession has some people out there that are misrepresenting it. So that's all I'm talking
Mhm.
about.
Yeah.
But at the end of the day, you just want your chiropractor explain your adjustment to you and actually tell you what's going on. There's so many different techniques that are effective. There's so many different ways that I've been adjusted. So as long as you go through that process, you'll be in good shape. But the last thing I want to do to a patient is just say, "Oh, you're in pain. I hear you're having some issues. Get on my table and let me adjust you." And that's it. That's just a huge disservice.
Nice. Those are some really great questions and good perspective. Oh, go ahead. Do you have more?
No, thank you. I had just thought about the stroke thing.
Okay, go ahead.
I did want to address that because that's a rumor as well. But I'll keep it short and sweet. There's been stories in the past, case studies. Basically, providers did not do their due diligence when taking in a patient. Like I said, a good exam, good consult. There have been instances where patients are already stroking out, going into a chiropractic office thinking that the adjustment's going to help with their horrible headache and
Mm.
their stroke ailments. Stroke wasn't identified. It should be 100% of the time. Turns out they still got treated by the chiropractor. Who's in the wrong? Technically, the chiropractor. You should have identified that. So that's kind of the story that gets blown up a lot. But statistically, you have a higher chance of getting a stroke sitting in your barber chair um, than you do getting a chiropractic adjustment. If you want to compare truths, always look at insurance companies. They'll always tell you the truths with their premiums, right? If you're an unhealthy person, have a higher premium. If you're a higher
Yeah.
risk, you basically consider not even having insurance, right? Orthopedic surgeons, let's say their premiums over here. Chiropractors, their yearly premiums are over here. We're around the thousands range of malpractice insurance, okay? And over here is the ortho surgeons. So they're in the hundreds of thousands range. So
Wow.
based on those premiums, I can promise you what we do is safe. And this office has been here for almost 40 years now and has by the grace of God never had an issue like that.
Mhm.
That's just kind of, we just kind of like to shut that one down a little bit.
Okay, all right. That's a good way to look at it.
Yes, ma'am.
And I think we have the tools to go and interview or even ask the chiropractor's office, like, what is your, I don't know, is it called onboarding? Like that initial client
Correct. Yeah.
assessment, that consultation, like what is your process? We can ask that question, what is your process for onboarding new patients, or what does your consultation include? And so
Mhm.
now I think you've given us a good perspective on the questions that we should ask, what we should look for. I feel a little bit more at ease in knowing what I should do when I'm looking for a chiropractor, and so I hope my audience does as well. Do you have any parting words? Is there anything that we did not talk about that you want to make sure that we cover?
Well, I honestly no. I mean, I've really enjoyed this, and I've tried to be as accurate and honest as I can with all the things, and I would just definitely say, please, consider chiropractic care if you haven't. If you feel like you've already had your mind made up that is something that you never want to try, at least just look at some Google profiles in your area and try to reach out to the doctor. I mean, a good doctor should be willing to talk to you on the phone and answer some of the questions that you have. But really, all we want for our patients is just better wellness, to be better connected with their bodies, better connected with their health, and hopefully rub off on them in a spiritual sense as well, and be able to, pray for them and just walk their journey with them and be their biggest fan. We give all the glory to God with everything that we do. That's what I'll end it with. We thank him for all the gifts that he's given us. And the ability to do what we do.
Absolutely, absolutely. Well, thank you so much for being here. I think you've given us great perspective. I appreciate all the things that you have shared, and I'm going to try to implement that and be more knowledgeable about some of the things that I'm doing in my own life.
Yes,
So,
yes, ma'am.
yeah. So thanks again for being here. And how can we find you? If you're on social media, if you live near, you are in Rainbow City, Alabama. Is that true? Right?
Yes, ma'am.
Yes, you're in Rainbow City. You are in Rainbow City, Alabama. So if you are in that area close by, the audience can go and find you there.
Yes.
But if we're not in your area but want to stay connected with you, are you on social media? Are there other ways that we can find you?
I'm on Facebook, Clayton Koon. More than welcome to add and ask questions. Our practice Facebook page is McClellan Family Chiropractic in Rainbow City, so you're welcome to go on there as well. And that should have all of our information, our phone number, email. You can contact us anyway, and we'll answer any questions that you have. I do want to say my thanks to you as well. Thanks for having me on, Monet. This has been great. I've enjoyed talking to you, and I think that think we're trying to do the same thing. We're just trying to educate. So I can appreciate that.
Absolutely, absolutely. Well, you're welcome anytime.
Yes, ma'am.
Well, take care, and we'll see you next time. Bye, everybody.
Yes, ma'am. Bye bye.
Thank you for joining me this week. Let's continue the conversation on social media at 1 Minute with Monet on all channels. Also, don't forget to like, follow, and subscribe to our podcast on your favorite platform. Until next time, be well and be balanced.